Hello, everyone, and welcome to this week's episode on Fit as a Fiddle. Our guest today is Nicole Kruck. She is the founder of Fertile Garden Wellness in New York City and has over 40 years of experience providing holistic treatments in acupuncture, Arvigo techniques of mind, abdominal therapy, herbal medicine, and nutrition to treat women of all different stages. She specializes in a lot of integrative kind of approaches. So she treats different things from fertility to menopausal conditions to digestion. And personally, I got a chance to work with Nicole while I was pregnant and had an amazing experience with her. We did some massage work. We did some my abdominal therapy, even like working around my pregnant belly, which was really, really fun and fascinating. We did some acupuncture, and she has such a very calming presence, calming touch, and a very central location in New York City that's easy to get to for everyone. And I just thought it would be wonderful for people to really learn about this work because stuff that she does is very niche and very important, and it's often underlooked or overlooked rather. And underrated because people think that, oh, we're going to go to a massage or masseuse, we're going to go get massage therapy. But the type of work that she does is very specific. And it's very important that people learn about these techniques. And if you fall under one of the various categories of people that she treats, seek care because there's a lot of great things that can happen over time with the type of work that she does. So after all of that, welcome to the show, Nicole. Thank you so much for being here today.
Oh, thank you so much for having me. It's a thrill to be able to be on your show because I love all the different topics that you talk about to support people. So I'm glad that I get to share what I do too today.
Yeah, absolutely. So, well, first, for listeners who may not know what the work is regarding just fertility and mind abdominal therapy, I want to kind of, what's your journey of getting into the space in the first place, and then what are the different things that you do?
So I came to the work that I do now because of personal things that had happened to me in the past. So when I was a child, I fell off of a big slide on my sacrum on my back onto cement, and I was probably about 5 years old at the time. And I was checked out by the doctor. Everything was fine. I never thought about it again, but I was also a gymnast, did a couple little sports, that type of thing, had lots of falls, had been in car accidents with my family, driving at different times. And when I got my period, probably around age 13, 14, my periods were always painful. And so, I figured that that was just the norm because, all my girlfriends, were complaining about the same thing too. And, never really thought about it much, but was really kind of, never looked forward to having my periods, really dreaded it, had to take some muscle relaxants for the first day or so, and just kind of trudged through. And at the age of 20, I went to another gynecologist, and she told me that my uterus was tipped, that it was retroverted. And I didn't really understand what that meant, but she said, oh, well, that's probably why you're having the painful periods. And, around that time I started to have intercourse, and that was painful. And up until I started doing the work, the same story. And so I said, well, what can I do about it? And she said, well, you could have a hysterectomy or ride it out through menopause. And I was like, well, I'm not having a hysterectomy at 20 because I don't know if I want to have kids. And, so I just kind of left there feeling really defeated and that I would just have to suck it up and do what I'd been doing for years. And, I was always interested in like different healing modalities, flower essences and herbs and, crystals, all that kind of stuff, growing up. But I never thought that they would be part of a journey to where I am now. And in 1996, I was going to massage school at the Swedish Institute here of massage in the city. And one of my girlfriends had gone to Belize and stayed next door to my soon-to-be teacher, Rosita Arvigo, who had a little like farm and a little store. And she's like, I see you studying with these people. And I'm like, yeah, I don't know. But she brought back a book of Dr. Arvigo's case studies of patients that she had worked with her teacher, who was Donalicio Ponte, who was a traditional healer there. And in the book, one of the women talked about having these painful periods and had a fall and blah, blah, blah. And I was like, oh my gosh, I really feel like this massage that they talked about could help me. So I tracked down Dr. Arvigo at a herbal conference, and several other women did too. And they're like, you have to teach us this information because it's really important. So several months later, she came back. She taught the first classes. And the most powerful thing about the work is that not only do I do work in the office with my patients, but we teach them how to do their own little 5-minute self-care massage so that they can go home and have treatments every day and be able to bring that the power of healing, through their own hands. And so I went home and started doing it 5 minutes a day. And first month was the first month I didn't have painful periods. Second month was, everything was better. Third month, no painful intercourse for the first time in my life at 37. I'm like, wow, this is so powerful. So it was like that was the turning point of like that I have to work with women because I feel like there's so many things out there that we don't get enough information. We never get the manual of like what's normal. Where normal is, our sisters, our, friends, what our doctors are teaching us. So I really my thing is about educating women, and I work with some men too, but mostly women. And I work with fertility, pre postnatal, um, women who have painful periods, PCOS, fibroids, polyps, Asherman's, all different kinds of endometriosis. And I feel like just giving them the opportunity to learn more about their bodies and to be able to connect physically with their bodies is a really powerful tool, and it can bring about a lot of healing. So
That's
that's the
incredible.
long story of how I got to where I'm at today.
I love that. And I think the thing that I like most about what you just said is how much it's helped you personally in your journey. And a lot of people who are, patient facing or client facing sometimes have experienced it on the other end and it's fueled their information. But in your case, it's like changed your life,
Yeah,
and
it changed my life and it changed my career path, and I realized that all the stuff that I had been doing trying to figure out what I was gonna do with my life really were a part of the pieces of that puzzle. And then later on, I ended up going to acupuncture school because I was going through some like menopausal stuff issues, and it was like someone turned on a light, literally, when I got acupuncture. It was like the hot flashes, the anxiety just like really calmed down. And then, then I'd go for back pain. And, like every time I went, it would fix it. I was like, I want to find out how to do that. And it was really the difference between like with massage, I can physically go in and work the tissues, bring in circulation, all of that. But with the acupuncture, it does those things as well, but it really shines with hormonal issues as well. So I like being able to bring the two into balance. And some people really like massage, but don't like acupuncture, or they like acupuncture, but they don't like massage. So, I do whatever that patient is wanting at the time or that day, depending on what's going on for them.
yeah. And how have you been able to kind of explain the more what people would think is woo-woo Eastern concepts of the acupuncture? Because I know, like, of course, there's a lot of science and centuries old practice, and we know this, and you and I know this, but sometimes people might be like, how can acupuncture help with fertility? Or how can acupuncture help me with a hormonal imbalance of menopause or perimenopause. How do you help educate and explain this stuff to your patients and clients?
Well, traditional medicine has been around for thousands of years. So whether it's acupuncture, Maya massage, or Ayurvedic, like before Western medicine, that was the medicine, and it really studied, really studied things very microscopically, right? Because the they didn't have MRIs, they didn't have blood work, so they had to really be present, and they had to be able to do a lot of things. Um, but now they want to have you want to get research and everything else. But basically, what acupuncture does is it creates a micro trauma to the area. So when you put a needle in, it creates a trauma, and that brings in like the natural killer cells, which helps to mediate the healing process. And so it can be looked at it different ways, but it's basically, I think of acupuncture as, the train system. When all the trains are running well, you don't think about where you're going, you get there easily, you're not upset, everything is well. But like if one of the local lines break down, one of the subways, you're like a little bit distraught, but you're like 5 minutes late and it's not as bad. But like if something goes down at Grand Central or Times Square, like it backs up all the trains, and you start to feel like more um you start to feel more agitated, your heart starts to race a little bit more, you think you're going to get yelled at for being late, you have to all of a sudden pee, but you don't want to leave the station, you know so things really back up in the body, and with these channels that move through the body, these train lines, that's what happens, and we don't notice things, if there's a little bit of a disruption. But as things get more intense and are in the body for longer, I feel like the needles go in and open up these stations, open up the channels in the body to help the body regulate itself, to bring homeostasis back, which is just that natural balance. And the beauty of it is like I know where to put the needles, but the patient's body is what's doing the healing process. And that's the beauty of it. It's not something, although I'm bringing a needle in, it's really your own body that's doing that process, which is a little bit different than Western medicine. And Western medicine, it can be a lot more invasive. And that's the same thing with the massage too. When I do the massage for especially like reproductive stuff, it's all done in the abdomen, but there's no internal work. So that's where physical therapists really shine too, because they can go in and do physical work, but this is all done through the abdomen. And it's not like deep tissue, it's more like we're just trying to get the circulation going. So we help to bring the body into more of a relaxed state. So not only are we working on like say painful periods or fertility or menopausal issues, but it's also allowing the body to relax at the same time, which helps the body to be more receptive for healing as well.
Yeah, I like that you explained how it's your body that's doing the own healing, um, which really helps people understand that a lot of their body is pretty strong. It's like pretty elastic and is capable of so much healing and so much change. And people are not doomed to the fate that they may have experienced. You for what, like 20 something years, you experienced, or more longer, maybe, like the painful periods and the pain with intercourse and this and that. And you might think, oh, this is how it's been. It's going to be like this forever. And sure, there's not, if you take a pill, it's not going to go away. So it's not like a one thing is going to fix it and that's it. I'm sure it was like a mental shift, a physical shift, things need to click and change. And most of the time it's holistic. It doesn't happen just at a local single tissue. It has to happen globally. And so doing the integrative approach to the work that you do, I think, is what's really important. Making sure that people really understand that, just because you have a retroverted uterus does not mean you need to go get a hysterectomy first and foremost.
Right. right. And that it can change, and that it
Yeah.
can change. It's only a lot of times the medical profession is seeing it as normal because they're seeing it every day. So
Hmm.
normally we see this, so this isn't a problem. But this was one of the issues that I found by doing, the massage on myself and getting my uterus, strengthening the ligaments to bring the uterus back into place so that everything could flow well, was my issue, and I was able to do that myself and non-invasively. So I didn't have to have a surgery, um, and it probably helped me from surgery down the road, from like maybe avoiding endometriosis or fibroids or polyps or something like that. So we're trying to address things, um, so that it doesn't get even more chronic if we can. But I get people in an acute state, chronic state, something that's been going on for a couple of months, or maybe they had a procedure or something too. Sometimes they get a DNC from a miscarriage or something else, and that can cause, all of a sudden my periods have changed, and now I'm getting painful periods, or I'm feeling some pain here. So, and especially with um, pelvic pain,
Hmm.
another thing that I see in my practice as well, which is so good to use with like an internal PT at the same time, because it's addressing it from both places.
Exactly. And like we just said, it's a global thing. Everything in your body is connected. Even posture, right? Like I'm sure you see people walking
Yeah.
in, the way that their posture or the way that you're holding your body in space.
Absolutely. And when the pelvis is out of place, that also keeps the uterus out of place as well. So we can help to strengthen the ligaments to bring the uterus back to place. But if the hips are not, in alignment, that also keeps it out of place as well.
Yeah. So working on the hips, working on the spine, it's just extremely important to make sure that I always say like the muscles are like the bubble wrap for your body. It keeps everything together. It's the thing that you can control. It's the thing that can be worked on by you actively. And then all of the other soft tissues, like the bony tissues and the soft tissues, the fascia, the ligaments, the tendons, could the tendinous joint junctions, they're all going to play a part in your healing process, and manual therapy can just be so important in just expediting that process and making sure that, like you just said, things are moving. The
Yeah,
movement is the most important thing. When things are stuck, that's when there's a problem, right?
that's
As
right.
long as things are moving, as long as you're able to move them with your own hands or practitioner's hands, and with your body movements, like just physically moving your own body, and things are not getting stuck and adhesed and just trapped, and the blood flow is there, and there's proper, functioning of all the parts together, that's when
Mhm.
healing happens. And I'm
Yeah.
sure you've seen that like almost in every patient that you've worked with, that there's like particular areas that just feel stuck, they feel different or asymmetrical from side to side.
Yeah, absolutely. Yeah, the hips are almost always out. A lot of times I've seen like people when we're younger, we're very active. So like me, we have falls, we do sports, soccer, like all that kind of stuff. And so we're constantly falling on our bottoms, And so a lot of times I would say almost 60% of the patients that I see, they've broken their tailbone at some point in their lives and didn't know it, you know. And so that bone is actually putting pressure on the pelvic floor as well. Also on the sacrum, the little triangular bone in your hip area, there's usually a lot of scar tissue in that area. So it's either the sacrum is always really puffy, or you can feel it's very ropey in there. And a lot of times when women get their periods, or people with uteruses, when they get their periods, they get a lot of back pain, and that's also part of that as well. So when I do the massage, it's very gentle. It's done through the abdomen, and we address all the organs in the abdomen. So the intestines, the liver, the bladder, the uterus, for men, kind of the prostate. And basically what we want to do is we want to open up the upper body, so like right underneath the ribs, because that's where the diaphragm is, just above it. And coming through the diaphragm are like three major vessels that one, the descending aorta, to like bring that blood flow down to the whole abdomen, but especially into the pelvis. And so a lot of times you'll notice a lot of people just breathe kind of in their upper chest. They don't breathe into their abdomen. And it's also like when we're really anxious, that's kind of where we're breathing from. So that circulation, that ability for the diaphragm to open up so that those vessels get that full flow, is lessened. It's like when you're watering your plants and somebody steps on the hose, not everything goes through. But when they get their foot off, then you get that full flow of water. So it's the same thing. We're just trying to let all the vessels, those arteries, veins, nerves, lymphatic vessels, get that optimal flow. So sometimes it gets stuck in the upper body, so we do some massage up in there, but especially in the pelvis. So the uterus has 13 ligaments that hold it up. They're like little hammocks in the front, the back, the top, and the bottom. So the uterus goes from like 4 ounces and the size of like a little lemon or lime to like a watermelon, right? When you're pregnant, and back down again. So it's like those ligaments have this amazing ability, the round ligaments, the broad ligaments, to really stretch when your uterus enlarges, but then has that ability to get small again, like within a month or so, if things are really healthy in that area. So that's what the massage does. We're basically just lifting the uterus up for a quick moment so that that circulation can rush through, bringing nutritious blood flow and oxygen and nutrients and hormones, and then take out any kind of waste products through the lymphatic system, so that everything's really healthy in that area. And when we're doing the massage too, we're doing like little bicep curls for those ligaments to help strengthen them, to bring the uterus back into place. So like a retroverted uterus is when the top of the uterus kind of goes back and it shifts the cervix, the bottom of the uterus, forward. And one thing that happens is when anytime the uterus shifts, the cervix comes out of place. So for me, what was happening, like I was having painful intercourse, and because my cervix wasn't in alignment, it was backing up fluids like cervical fluids. Things weren't flowing as well, so my cervix was inflamed. So when I had intercourse and I had penetration, it was hitting the side of the uterus, which is a little bit more hard. You can think of like the cartilage in your nose, like it's a little fleshy and moves, but it has more structure. So it was hitting up against that in this inflamed area, and it was really uncomfortable. Sometimes other positions were a little bit better, but that's what happens. And then, like, if a uterus goes anteverted, it's kind of sitting on the bladder. So women think, oh, I'm always having to pee all the time. My bladder is, I have a little bladder. It's just because there's less space because your uterus is sitting on it. And especially, your uterus goes from like 4 ounces to like 6 to 8 when you get your period. So as you're getting closer to your period, that weight is causing either more problems on your bladder, so you feel like you have to pee more, or it can be like more constipation, diarrhea, because it's sitting back on the intestines sometimes. And just to say too, for like fertility, that's not creating an optimal environment for conception. I mean, we get pregnant under all circumstances, but for someone who's like thinking about conceiving or wanting to conceive or trying, like, you want to get stuff in the optimal place so that it's really getting that fabulous circulation, so that the lining is getting really thick. You want to make sure that the fallopians or tubes are open, because if those eggs can't get through, you're not going to get pregnant. You might get like a topical or something, but it's more optimal to have those tubes open. So as we're doing the massage in the pelvis, it's stretching them to keep them open. There could be some scar tissue in there, some fluid. So just doing the gentle massage helps. And we're not doing more massage than like a little bit more than what you would do when you're putting on your lotion. It's not like a deep tissue painful thing. It usually feels pretty good. There's some areas that might feel a little bit more sensitive, and we just work with someone. If you're not comfortable with, being touched in a certain place, or it's ticklish or whatever, it's the when I work, it's always about you. I'm there to support you however it works for you, because it's your body, you're living in it, you know it better than anybody else because you're there 24/7. So, yeah, like me, it took about 3 months to get my uterus back into place. But sometimes it's quicker. But sometimes something might have been out for 40 years. So we'll get different degrees. One of the things that I get a lot more lately, and maybe you're getting it, is Asherman syndrome.
No, I haven't heard a bunch of it, but tell us about it.
Yeah, so many times women will have to have like a DNC after, say, a miscarriage or something, or there could have been like some kind of STD, where they just need to go in and clean out, the first layers of the endometrial lining in the uterus. They just kind of scrape it out. And so sometimes with some women it can create like scar tissue, and the uterus, instead of being like an open balloon, starts to collapse on itself in areas where you start to get these adhesions. And so it can cause some issues. But one of the problems is with like fertility. There's not enough space in the uterus to sustain a pregnancy. So I've had a lot of more and more, I'm having more of these, and come into my office, and we're working with those, and really helping women to be able to actually have babies, to full term. So yeah, there's a lot of things that people don't talk about, because it's very it's it, it people people don't talk about women's health a lot out in the world. We talk about breast cancer and all these cancers, but we don't really talk a lot about what's going on behind the curtains or in our homes and stuff. But people are starting to get a little bit more active about talking about IVFs and problems conceiving and postnatal and all of that. So I love to be a part of that conversation.
I know, I totally hear you. I think even just years ago, when I started, I didn't see as many people even coming or knowing about pelvic floor PT, for example, or even many people talking about IVF, or many people have even reported, like when I have a medical history and I ask them for different things and have you had any procedures or this and that, and they usually wouldn't even say any of that stuff. And nowadays I actually have people putting that into their medical forms or talking about it with me in the clinic or at the office. And I think there's a little bit more awareness, and that's another reason we're doing this podcast, is right to bring more awareness, bring it to light. It's okay to talk about it. Like you've been so open talking about your journey here, and I think it's really important for people to hear that, because not only was that your journey, but you actually have personal experience and professional experience now, having overcome it yourself, and that informs your practice even more. And so, yes, I think that, yeah, it's definitely hard to talk about. I don't know if anybody who's listening feels like they resonate with any of the kind of symptoms or different problem areas that Nicole has discussed here. But the point here is that it could be happening for many reasons, but there are solutions behind this. And they're mostly, first line of defense is not invasive and is not surgical. There are very extreme cases in which that is true and it's life-saving measures. But most of the times when there are chronic quality of life issues, a surgical procedure with no conservative treatment on the side, or non-invasive or minimally invasive things on the side, is not the right answer. Typically, that's like a blanket statement, but most of the time you should be trying some of these treatment approaches first, because they're happening for a reason. So the surgery may not actually solve the problem, right? It's like that, like for example, I always tell people, like when they come to me with urinary incontinence, which is probably one of like the top 5 things that somebody might come to me for if it's pelvic floor, and particularly postpartum pelvic floor issue, they'll come to me with urinary incontinence. And a good majority of them will say that I spoke with my OB or GYN, and a very small portion would have been referred to pelvic floor PT, but a much larger portion will either be told you're going to live with it, or you can just get a surgery. We're going to do a little hammock surgery and then do this. And in my head, I'm thinking, this urinary incontinence did not exist for them prenatally, right?
Right.
There's a reason for this. There are tissues that go through dramatic amount of change at the pelvic floor,
Quickly.
postpartum, yeah, pregnancy, birth, and postpartum. And this is a musculoskeletal situation most of the time, right? I mean, I've treated people with like a very severe hernia, a third-degree prolapse with urinary incontinence, and we can still work on that and improve the quality of their life and get them to practically symptom-free. I'm never going to promise someone they'll never experience anything ever again. That cannot be that's usually not the case, and somebody who does promise you that in X number of sessions is probably lying to you, because everybody's body is different, like you said. But there's different degrees to which we can work with this, and just jumping into a surgery, that's not helping them with how are they holding their body in space, how are they lifting their baby, how are they breathing, how are they constipated, what's happening with the muscles at their pelvic floor, and on and on and on and on, that are contributing to this, because that's not fixing that, right?
No, and you're
So
educating them at the same time. Because
mhm.
not only like I think with Western medicine sometimes like you definitely want to have it and sometimes it can be great in combination with what we do, but you also have to realize that that it's a more blanketed type of medicine. It's not geared for one-on-one, right? Which is what traditional medicine does. What you do with physical PT, you're looking at the whole person, and what's going on in that moment, in that snapshot. So it's like, so that's the beauty of what we do. And I kind of lost my train of thought, but a little bit. Oh, I know what I wanted to say is that a lot of times because Western medicine is a blanket approach, that they're giving things to help quickly, like, you've got some big infection, they're giving you an antibiotic right away. Well, it's going to treat it with the infection, but there's going to be side effects from it, you know? And so that's the thing when you're working with, practitioners like us in more of a holistic way, the side effects are usually side effects that are like enhancing your life on top of it. So I might be doing someone's having painful period or fertility issues or whatever, and I'm working on the uterus, but I'm working on the whole abdomen. And so now the constipation that they've had for a very long time is going away. They're sleeping better because their nervous system is allowed to regulate better, and we're addressing the reproductive issue that was going on as well. Same thing with you, they're coming in with pelvic pain, but like they're like, oh my gosh, I didn't know where my pelvic floor really was. I've been hearing about it, but I never could connect, I couldn't feel it, and they're having an experience to connect with that. And when we connect with something on a personal level, it can change our lives and the way we view things. And like you said, that's how I got into this medicine. It like opened up my whole world, and I was like, I it became my mission to help other women because that information wasn't out there. And even if I can get somebody to like find out where their uterus is, most of them think they're up at their belly buttons or higher or whatever. Well, when you're pregnant it can be, but normally it's like just like right above the, we can't feel the whole thing, but the fundus, the top of the uterus, that's what I feel just above the pubic bone usually. So,
Yeah,
yeah.
I love that. Oh, Nicole, we could go on and on and on and on. Is there anything that you feel like you wanted to share with our audience today that you haven't said yet?
Mm, I think I covered a lot of it. I think I I'm just so grateful that there's this whole community out there. You, me, other practitioners to help women on their journey. Um, to really be able to live have the health goals that they want in their lives and that it's possible. So if you're not getting an answer from your doctor that feels comfortable for you, you're like, I don't know if that really fits me, but you say, oh, they're a doctor. Like investigate, because there's so many different kinds of therapies out there now that can really that may match you. It's like homeopathy. When you take a homeopathic pill, sometimes it works, sometimes it doesn't, even if it's made for that condition. But you find your own remedies that like match you, and you're like, that's my remedy, or that's my physical therapist, or that's my physical therapist and acupuncturist, or whatever. So just step outside the little box. You live in your body 24/7. It's telling you stuff. Find people that can support you. Find a health team that you can. And I love the work that you do, because it really you're so right. It encompasses everything. The way we move in the world, the way we move our tissues and our bones, should be joyful and free. And we have the ability to have that. And so seek that out.
I love it so much. Thank you so much, Nicole. You are incredible. Your work is incredible. And I'm really glad that we have met and that I got a chance to work with you and now do a podcast with you. So always fun. And maybe we'll have you on another season for another topic, because I know there's so many things to talk about in this field. So we're so grateful. Thank you for your time.
Yeah, thank you. And I'm in Union Square if anybody wants to see me personally. And I also do telehealth as well. And if I can't help you, I will help find someone else in the country or states or countries that can do that as well. But thank you so much.